The Guyana Public Service Union's 72-hour notice of industrial action expired on Tuesday. The union, in an ultimatum issued to the Minister of Public Health, Dr. Frank Anthony, and Chief Executive Officer of the Georgetown Public Hospital, retired Brigadier George Lewis, outlined its plan for some 500 healthcare workers to strike countrywide if all healthcare workers, particularly those employed at the Georgetown Public Hospital, were not categorized as frontline workers, who will in turn benefit from the risk allowance promised by the government. However, hospital officials, while acknowledging the strain the strike action would present on the operation of the institution, have devised possible measures that can be implemented if the healthcare workers decide to follow through with full-scale strike. Shalana Providence, head of strategic planning and communications at the Georgetown Public Hospital, in a telephone interview with this newscast, informed that some of the measures include reducing patient load at the institution, which could result in the suspension of clinical services.
And giving patients home treatment plans, which can be followed up on by our patient care advocates, and in some instances the doctors who are working with those patients. We'll have to look at some rearrangements with staff. Yes, we do have some nurses who are striking, but the hospital has about 1,000 nurses in its employment. And so we'll have to look at how we can reschedule those staff in a way that allows us to have some nurses at work.
Providence added that in some instances, doctors will be asked to assume the responsibilities which were undertaken by the nurses who would have chosen to be part of the strike. She noted that even with a reduced staff complement, the hospital's intent is to maintain the same level of care for patients who require treatment at the institution.
We cannot guarantee persons that they will receive service as quickly as they did before. But we are committed to ensuring that we continue the same standard of practice in terms of delivering care, whether we're utilizing our doctors or the few nurses that we have at the hospital.
According to Providence, Lewis, by way of letter, has requested a meeting with the Guyana Public Service Union, but is yet to receive a response. She highlighted that the hospital is hoping that the grievances of the healthcare workers can be solved amicably and that the matter does not escalate into them striking, considering the large influx of patients the hospital has been receiving over the past 2 weeks. On Friday, it was reported that several nurses on the night shift who attend to critically ill patients at the hospital reported sick as the fight for better salaries and allowances continued. Healthcare workers from 4 administrative regions in the past 2 weeks spent hours protesting for risk allowances, adequate personal protective equipment, and 50% salary increase. The Guyana Public Service Union is expected to issue a notice on the way forward soon. Timeka Rodney reporting for the HGB Nightly News.